We have what we need to deal with a absolutely tragic situation. Our job is now to focus on what we need to do to save lives. Dr. Barbeau, do you want to speak about how precautions are being taken?
Yes, sir, Mr. Mayor, and I want to just echo what you've said in terms of all of our efforts thus far really being geared at reducing the spread of this virus and giving the healthcare system an opportunity to absorb the number of individuals that are unfortunately stricken with COVID-19. With regards to COVID-19 and people who have deceased because of it, there is no indication at this point in time, based on experience from other countries, based on the science that has been published, that there's any risk to individuals from this respiratory virus. I want to remind you that it's a virus that's spread by droplets, and after someone is deceased, there is no risk. We at the Health Department are very focused on working with funeral homes and ensuring that as one of our essential services, our burial desk is working 24 hours a day to help meet the needs of families that have unfortunately lost someone to COVID-19.
Okay, go ahead.
Next, we have Shant from the Daily News.
Yeah, thank you, Mayor. I was wondering if you could elaborate a little bit on what you want to see from a fourth stimulus. Do you have a dollar figure in mind, and what kind of things that funding would go toward?
Yes, Sean. And this is a conversation. Look, and I'm always grateful when our federal officials are responsive. Secretary Mnuchin was very responsive. Obviously, on the legislative side, I've spoken to Speaker Pelosi and Senator Schumer. They've been extraordinarily responsive. There's no question in my mind at this point that a fourth stimulus bill is coming, and coming relatively soon. I spoke to Senator Gillibrand about this as well. I mean, everyone's saying the same thing, and that's a very encouraging sign. Our delegation, I spoke to the entire congressional delegation a few days ago. Obviously, Congressman Jeffries is very high-ranking in the House leadership as well. Everyone is agreeing that another stimulus bill is coming soon. We have to ensure that that stimulus bill reflects what's happening now, not just in New York, but increasingly, tragically, all over the country. And you have noticed coronavirus doesn't discriminate. It is now in all 50 states, red states, blue states, big and small. The next stimulus needs to replace the lost revenue that cities and states have lost as a result of coronavirus. There is no other viable path to making up the kind of revenue we've lost, billions upon billions of dollars, very quickly, more to come, unfortunately, while we're trying to keep essential services going. And I want to remind everyone, anything that's about saving lives right now, money's no object. We're going to do everything and anything to shore up and strengthen our hospitals, to support our first responders. Whatever it takes to save lives, that costs a lot of money, and it is the right way to use money. But if you combine all the huge new expenditures with all the loss of revenue, and we have to provide the basics every single day, we still have to fight crime and make sure the garbage is picked up and everything else that the city does. I think it should be literally replacing the lost revenue and funding the additional expenses that were incurred because of COVID-19, and that should be for all states, all cities. But this time, instead of a bill that treats everyone like there's no differences in the reality, this bill must reflect where the actual epicenter has been and ensure that New York City and New York State are truly whole, not just a token amount, but are truly whole.
Next, we have Aaron from Politico.
Hi, Mr. Mayor. You said on Friday that you were considering $500 fines for social distancing violators, and you were going to make a decision this weekend. Where does the decision stand on that? And relatedly, when you say NYPD is doing spot checks of subway cars, what are they checking for exactly? The MTA is determining the number of cars being run, right?
Yeah, but the point is, obviously, NYPD is in the subways always, and the instruction, in addition to everything else that the NYPD does for safety in the subways, is to go out and look for any instance where there's a crowded train car and immediately clear it. So when we say spot checks, it's not just watch and wave, it means intervene, clear out that car, hold up that train, get people spread out immediately, do not allow any crowding. And obviously the information is crucial too, to understand why it's happening and what adjustments the MTA has to make. On the use of fines, I believe, and we said it with the religious institutions, very small number, I want to emphasize. There was a very, very small number of very small churches and synagogues that we were concerned about on Friday. Thankfully, this weekend, we did not see much of that activity. I think they got the message. I authorized fines and closing buildings if needed. I certainly do authorize the use of fines in parks and playgrounds if needed. Again, what we're going to do to begin, as we've been doing is, and the weather has been such that there haven't been too many people out, but all of our enforcement officers have been given warnings. I've been educating. There's been loudspeakers telling people the update, all that. Now it's as simple as this. If someone is told by an officer, disperse, keep moving, you're not distanced, and they don't follow the direct instruction from our officer, or they say they're doing it and then they come back right away, I'm comfortable at this point that they will be fined. My understanding is the fines are in the range of $250 to $500. That'll obviously be a violation, a summons that would be provided. I don't want to see that happen, Aaron. I want to just let all New Yorkers know that what we're trying to do is say, you've been warned and warned and warned again. Now, if an officer comes up to you, if someone wearing official city uniform, official city identification comes up and says, move along, disperse, etc., if you ignore that order, they're going to say, if you ignore it, we're going to have to fine you. They're going to give people every chance to listen. And if anyone doesn't listen, then they deserve a fine at this point. And I don't want to fine people when so many folks are going through economic distress. But if they haven't gotten the message by now, and they don't get the message when a enforcement officer is staring them in the face saying, I don't want to fine you, but if you don't change what you're doing, I'm going to have to, well, that person then deserves the fine. So we are going to proceed with that as part of how we intensify our enforcement.
Next, we have Sydney from Gothamist.
Mr. Mayor, this is Sydney Pereira with Gothamist. I was just calling to see if you could elaborate on whether you're reevaluating closing parks and playgrounds or increasing the scrutiny on congregating in those types of open spaces.
Sydney, here's where we are, and it'll be obviously an ongoing conversation with the state and the city council, but at this moment, what I want, because we've had a little bit of an aberrant situation with the weather, but it's very much connected to what I just said. If we see, and I know this from talking to our police commissioner who's with us, who's constantly, he and I are comparing notes on what he's seeing, his officers are seeing, and obviously what Parks Department's seeing. Any place where we see any consistent violation of the new standards, we will simply do a series of direct things. If it is, for example, a soccer field, a tennis court, a basketball court, any place where we see people ignoring the rules, we'll just take the equipment out immediately. We've already started to do that with all three of those categories. And I think people will get the message very quickly. If you keep doing things that are inappropriate, we're taking it all out, you're not going to be able to do it anymore. In terms of playgrounds, again, we have not seen much noncompliance. If we see any noncompliance, we'll begin by shutting that playground down. If we see broader noncompliance in the coming days, at any point, I may give the order to shut all playgrounds. But what I am trying to do is do this a little bit in stages to see what we might be able to keep open, because I'm really feeling how much New Yorkers have been deprived in these last weeks and will be deprived for quite a while of so many of the things that we used to have. I'd like to keep something available for people. But I have to be pretty fast to say if I see, and if our police see, if our enforcement agencies see a pattern of non-compliance anywhere, we will take action on those individual sites. If it becomes a bigger pattern, I mean literally over a matter of days, we will be watching everything and acting in each situation. We see a bigger pattern, we will take an even bigger action.
Next, we have Katie from the Wall Street Journal.
Hey, Mayor De Blasio, hope you're doing well. I wanted to thank the city's health department and your administration for releasing that map on Friday, but I'm curious if you could release the raw data, because as the map stands now, it's sort of meaningless to not know the raw numbers. And it actually, like you said yourself on Friday, it actually might confuse people. Would you take into consideration releasing more of that information? Because I know that clearly the city has it if they can produce that map. Thank you for considering.
Thank you, Katie. Yes, and you heard correctly. The map showed something, but it was a little hard in some ways to get the true meaning out of it. And we are looking for measures that we think are more, give you a fuller picture, give you better, more consistent information. The more we can determine will be actually consistent and accurate that we can put out, we do want to put out more. Dr. Barbeau, obviously with the caveat that we understand the imperfection of that map, if you're willing to put out the raw data, that's fine with me, but you know more about the details than I do.
Yeah, Mr. Mayor, I appreciate your remarks, and we're all committed to transparency here. And as we've said before, a lot of this is evolving quickly, and we want to be able to produce consistent maps that have reliable, accurate data on a daily basis. And so we're definitely working hard at ensuring that the next tranche of data that we release are data that can give folks a more granular picture of what's happening at the city level.
Okay, and we'll follow up. Our team will follow up with you, Katie, on the specifics.
Next, we have Miles from NBC New York.
Hi, Mr. Mayor. Good afternoon to you. I'm looking to get some information regarding the police department. They yesterday said that they would do some kind of work from home, a reasonable accommodation. I think that it came in after the detective died yesterday. Just looking for more information on that.
Dermot, are you with us?
I am.
Go ahead.
Can you hear me?
Yep.
So since this unprecedented time really kicked off 3 weeks to a month ago, we've been staggering our workforce, working from home. We have thousands of employees working from home as long as they can do those jobs and still operate at a high level with the police department delivering functions. We've given discretion to our frontline commanders in terms of accommodating people, particularly people over 50 years of age with vulnerabilities such as this disease seems to strike harder. So I think that we've been consistent in that. We're continuing to look out for the safety of our employees. We did put a message out. Already have had some people contact us seeking accommodations, and we're going to work with not only them, with the unions to make sure that our workforce is as safe as it possibly can be.
Thank you.
Next, we have Craig from The Post.
I was wondering, Commissioner, if we can get an update on the staffing levels in the NYPD, and just with that, if we could, what is the time frame once an officer is getting being a confirmed case that they're going back to work? What's the guidance there?
So we can get back to you in terms of from our medical district. Has to do with whether you tested positive or not, whether you have a fever or not, whether you have a fever and you're off medicine or not, when the symptoms started. So there's a series of different protocols that our medical professionals go through. I can tell you that in the last 2 days, we began to have people for the first time that had tested COVID positive now returning to work, and we anticipate that that number now as we move forward is going to significantly grow just as this situation matures. Where we first started to see the sick numbers grow was roughly on March 12th. So as you plan out from that day and you look at periods of whether it's 2 or 3 weeks after an individual goes sick, we know that those numbers are going to continually grow. We're looking at both sides of the spectrum, quite frankly. What is the current sick rate as officers are still becoming infected, and when is that beginning to plateau, as well as forecasting out 2 to 3 weeks, and when is it going to attrition on the other side. Where we stand as of this morning is we're closing in on 5,000 members currently out sick. And we have, I would anticipate by tomorrow morning, close to 900 tests positive for COVID.
Go ahead.
Next, we have Jeff Mays from the New York Times.
Jeff? Jeff,
How are you doing, Mr. Mayor?
there you go. How you doing?
Good. How are you? Can you elaborate on the number of lives lost over the past 24 hours? And I don't know if Dr. Barbeau can maybe talk about the projections for that number. It seems to be increasing pretty rapidly every day.
Yeah, Jeff, it's really, really painful and troubling. And yes, it is growing. It's been growing. It keeps growing. And, when I hate to say it again, but it's just true. April will be worse than March, and I fear that May could even be worse than April. Like, we've got to get in our minds against all that rhetoric of, everyone get back to work or we'll be done by Easter. That's just not true. We're going to be in for weeks of this. When exactly it peaks and starts to go back down, I think, different projections say different things, but the worst is definitely ahead of us. And that's why we are, intensely working to lay in the kind of personnel, supplies, equipment, everything to try and save the maximum number of lives. But even with that, we're going to see, a really, really painful number of people lost in this crisis. Oxiris, do you want to speak to that?
Certainly, Ms. So thus far, from the individuals who have passed as a result of COVID-19, the vast majority have been above the age of 75 or have had chronic underlying illnesses such as emphysema, diabetes, been immunocompromised, et cetera. And with regards to the numbers that we are anticipating, I think at this point, as we've said earlier, all of our efforts have been really directed at reducing the number of individuals who contract the illness and who become severely affected by it. But the reality is that if we think about sort of a typical flu season, on a yearly basis, New York loses roughly 1,000 to 2,000 people because of influenza. I think that we are on the scale of having many more people die because of COVID-19. And so, right now it's challenging to give an accurate number in terms of projection, because every day that New Yorkers adhere to the social distancing is another day that we buy the healthcare delivery system an opportunity to meet the needs of those that are affected by COVID. So I think, we're definitely on track for having more deaths than we would typically see in a flu season. And part of the challenge there is that it will happen in a shorter amount of time. And as the mayor started off this press conference, these are unprecedented days, and days that are going to be challenging for every New Yorker. And it's really a time for us to dig deep into how it is that we come together. Though we may physically be distanced, we need to really dig deep and come together emotionally and spiritually and be there for one another.
Amen.
We'll take two more. Next up is Samantha from 1010 Wins.
Yes, hi. This question is both for the mayor and the police commissioner. Has there been an increase in domestic violence calls with the lockdown? And for women or victims of domestic violence who may be afraid because the courts are closed and services may be limited, are there resources for them? Do you have a message for those people who may need help?
Samantha, I really appreciate the question. It's something we've been talking about, that we're worried about what happens in a crisis atmosphere like this, and who may be vulnerable at a time like this. We have to make sure that anyone who might be a victim of domestic violence is protected, even in a crisis like this. So the NYPD, and the commissioner will speak to it, I mean, they have done more and more over the years to try to disrupt the horrible, horrible situation with domestic violence and to follow through when they have any sign of that danger, including the recurrence from previous cases. So that work will continue no matter what else is going on here. And we need to make sure if anyone feels in danger, that's a priority immediately to act on it. And they can reach out to the NYPD. And, you know, this again, NYPD is prioritizing domestic violence always, but especially in this crisis. Dermot, you want to follow up on that?
No, Mr. Mayor, you hit most of the points. I mean, the message is domestic violence is an extremely high priority for all members of the New York City Police Department, from the police officer level to the domestic violence officers that we still have on hand that can aid and assist you in your particular situation, and the detectives as well. It remains a high priority for us. I think it's a very good question, and that it is something that we're very mindful of. We have not seen it manifest in across the board increases yet, but it's certainly something that concerns us for the possibility. What we've seen is generally a reduction in crime, not just in domestic violence, but many crime types over this last roughly 3-week period, excuse me. What we worry about in some types of crimes, particularly domestic violence, is it occurring and there's a lack of reporting? And that's certainly something that's on our mind. To try to combat that, we're reaching out to households where we know there has been domestic violence in the past, as kind of trying to get ahead of things. But thus far, we have not seen a reported increase in domestic violence.
Excellent.
Last one, we have Jarrett from City Limits.
Hi, Mr. Mayor, Commissioner Nigro. This is a question for you regarding the strains on the 911 system. Can you characterize what the impact of those has been? Are calls being rerouted? Are we going to neighboring towns for mutual aid? And related to that, have you changed or are you thinking of changing the types of calls, medical calls, that fire companies themselves respond to?
Well, we're in an unprecedented time, of course. The last 5 days have been the 5 busiest days for the EMS in their entire history. And today, no doubt, we will be over 6,000 calls for the day, which is more than 50% higher than an average day. So the impact that has had is slowing our responses. Of course, our resources are not infinite. And so 6,000 calls are difficult to respond to. It causes significant delays in the lower categories of calls, the less critical calls for help. And that's happening now. As far as the firefighters are responding to the critical calls, the cardiac arrests, the choking, the major traumas, along with EMS and paramedics. But the bulk of these medical calls is falling on the shoulders of our EMTs and paramedics.
Okay, and Dan, as we said, we are going to make a number of adjustments very quickly, and this level of activity is unprecedented. Commissioner Nigro and I have spoken in detail, along with Deputy Mayor Anglin, about any and all adjustments we need to make to get additional personnel into place, to move people to additional types of work, whatever it's going to take, to make sure that those emergency calls of all kind get answered in real time. And whatever it will take to add shifts, we'll keep doing it, and noting that there's ways to make sure that those calls that might be handled a different way and don't need emergency support can be handled a different way. But I want everyone to understand, Jared, it's a very, very crucial question. I'm glad you asked it. We must remember, even in the midst of this terrifying challenge of COVID-19, we still have to fight crime every day. We still have to ensure that fires are fought. We still have to ensure that anyone who calls 911 having a heart attack or any other emergency gets emergency help. We will keep shifting resources, personnel, vehicles, whatever it takes to keep that going. This is another example of, remembering that this crisis requires of us not only a massive healthcare response, but a massive response to keep all the rest of life in the city going and to protect human life in every other way, because human life is threatened by things beyond COVID-19, and we cannot let down our guard on those other fronts. So whatever Dan Nigro needs, he is going to get so that we can keep the 911 system functioning strong, and so that New Yorkers can know when they place that call and they have a real emergency, help will come and will come quickly. With that, everyone, thank you. We will be back tomorrow with more updates. Thank you very much.